Labor's promise to open 50 urgent care clinics has been criticised for failing to address the immediate pressures on emergency departments. The Australian Medical Association claims the plan would do little to relieve the hospital logjam while further fragmenting care and crowding out local GPs. This was the AMA President Omar Khorshid earlier on Sky News.
The announcement that we heard yesterday was another example of a piecemeal announcement where, it's a good idea by itself for people who are able to access the clinic. They will be popular, but does it actually fix any of these deeper problems in the health system? Absolutely not.
For more on this, let's bring in Professor Karen Price, President of the Royal Australian College of GPs. Thanks very much for your time. I'll get your response in a moment to the AMA, but let's just talk about the problem we're trying to solve. So we're talking about people that need care that's significant enough where a GP surgery might struggle to give adequate care, but a hospital will have you pretty low down the triage list. Can you give us the best examples?
Well, this is the sort of stuff that general practice used to do, but has been progressively defunded with over time. And also with the workforce shortages that we've faced in general practice, which have run in parallel with the defunding of primary care in the community, we're now facing this time shortage and also the ability to support that level of care. So GPs, when I started, we always did our own fractures and lacerations and so forth, but it's become increasingly difficult with workforce shortages and the rise of chronic disease management and so forth. So, it is a critical issue. And I was just in Launceston yesterday looking at an acute care clinic that was embedded in a clinical practice. And certainly that model was working, but it wouldn't be supported by bulk billing rates. There is no way you can run an acute care centre on bulk billing rates.
So, and specific examples, are we talking maybe a broken leg that's not, that's a simple break, if you like, or a second-degree burn? What sort of incidents do we see people sitting in a hospital emergency room for hours and hours?
Children's fractures and, simple fibular fractures of the lower leg. An assessment and stabilisation often may be needed before they are agreed that they need transfer to hospital. Having an experienced general practitioner manage some of these conditions then alerts the emergency department staff that this is something that does need escalation. So there's also that role for the acute care clinic. So, we also manage degrees of heart failure, potentially whether or not something is, a simple, early chest infection or a pneumonia. These sorts of things can be well dealt with. Someone becomes acutely unwell and we need to sort out what needs to go on to hospital, what can be managed in the community. And many of these can be in the community.
So I think we've all had that situation where we think, do I really need to go to hospital or not? And that's the gap. But if that's the case, why is the AMA unhappy about it?
Well, the AMA are, and I had a chat with Omar yesterday, and I think we are actually more aligned, that the issue is that we don't want a Band-Aid solution to this issue. This issue is just the tip of an iceberg of the defunding of primary care over time. And what we want to see is not a separate, siloed, fragmented, yet another single issue solution. What we want to see is this is embedded in a workforce that is trained to do it, but hasn't been resourced well enough. So after our care was defunded, and we need a sufficient workforce. But it's been shown with the clinic that I was at in Launceston that it can be run, it can be done well, but it needs more than bulk billing support. That clinic also received an infrastructure grant so they could build extra spaces, and it receives a state top-up, because we know that when someone presents to an ED, it costs the community $500 at least. So this is... And
as I said as well, I think lots of people don't want to go to hospital if they can avoid it, so I get the gap. But what are you saying, that this is not a big enough announcement, that it's not holistic enough in its funding? What's missing here? What's
missing is it's short on detail. And we need to see that this is absolutely embedded in existing general practice. That is the major health service in the community. Don't want to see separate standalone clinics. Now, in Omar's state of
Labor seems to be saying that today. Do you believe that's not clearly put out in the policy? Because they're saying that's the difference between the GP super clinics that got shut down and this idea. They don't want new infrastructure.
It is an announcement at this point that we welcome the reframing of acute care back into general practice, but we need to see the detail, and we need to see how we're going to workforce. We need to see 50 clinics across Australia is not going to touch the bottom. There's, over 7,000 clinics that this could run through. So we need to see the whole plan and how it fits into the system. If we just patch over the bits, we're going to have bitzer and patients will not know precisely where to go.
Okay.
And
just finally and briefly, sorry, did Labor consult with you on the policy?
No.
Okay. All right. Appreciate your time today, Professor Karen Price.
Thank you.